Okay. Yesterday we discussed about Shodhana of important Vishadravyas used in our clinical practice, regular clinical practice, and their important antidotes. So usually, while we are prescribing a medicines, we'll prescribe medicine for 15 days, 1 month. Many times, what patient will do, they will continue the same medication for 3, 4 months. So without their knowledge, if you are giving the prescription, so if they are getting well with the prescription, they will send or circulate the same prescription to the other peoples who are suffering from the same problem. That is the problem with the prescription writing. So this is another thing happened in allopathy in super specialization. They are fear about so allopathy drugs having some common side effects, and for more days they cannot take the same medications because of cost also. Okay, so on their own, they won't select allopathy medicines or the same prescription, they won't take it for longer period. But in the minds of people, they think that Ayurveda doesn't have any side effect. And for long-term use also, nothing to worry. And they will prescribe and they will take available company medicines nearby. So, and they are continuing the same medicine for longer duration. So our medicine strength is differs from company to company. For example, if you consume a Chitraka devotee of Baidyanath, so it is Tikshna. So in Chitraka devotee, we have a two bhavanas. One is from Nimbu Swarasa, one more is from Dadima Swarasa. If you consume a Chitraka devotee with Nimbu Swarasa bhavana, definitely you will getting a loose motion after consuming 2 to 3 tablets. Okay, we cannot give Baidyanath and Chitraka devotee for longer period. Same if you take Kashmir Chitraka devotee or any other Zend Chitraka devotee, these are all these company medicines are not so thick because they're done bhavana with Dadima Swaras. Okay, if you consume the Chitraka devotee for 1 month or 2 months also, we don't have any issues with a GIT problem. So metabolism will improve. So same like that. If they are consuming a medicine which contains higher amount of Vishadravyas for longer period, so we can expect some side effects with the medicines. If the patient come with so and so side effect, at that time we can able to identify what type of Visha it is, how to nullify the Visha, and what are the antidotes we can advise or prescribe during the particular time. So Ballataka, I have told you, so Ballataka is an excellent drug in case of Kaphaja Vikaras. Whatever may be, it may be a cyst, it may be a PCOD, or it may be fibroadenoma of breast, or it may be goiter. So any cyst or tumor in the body is dominant of kapha. So one contraindication for the prescription of Ballataka is you should not be prescribed for a Pittaja Prakriti. So Pittaja Prakriti person having a tumors, if you prescribe Ballataka preparations, it may be Ballataka Vati or Ballataka Druta or Ballataka Taila or Ballataka granules internally. So there is a problem with the Pitta. So there is a tendency of bleeding internally. Okay. So these things we need to consider while prescribing a Ballataka Vati. And same thing will apply in case of Shiva Gotika, it contains higher amount of Shilajitu. So again, it will aggravate some amount of Pitta. So these things you should consider first, and then we can plan for a prescription. So actually, patient need the medicines, but body conditions and the Rutu will not support the prescription, will not support the medicine. Suppose, so Tikshna Aushadhi should not be given in Sharad Rutu because of Pitta Prakopa Kala. If you are given a Tikshna Aushadhi in a Pitta Prakriti, so it will lead to the bleeding. Your prescription or your medicines will not succeed. So within 2 to 3 days, patient will come with a internal bleeding or external bleeding. They may complain about a piles, or they may complain about epistaxis, bleeding from the nose. They will start up with a severe burning sensation, severe pain. So patient will come back. So if you are advising a plain Vishes in the cavity with a silver tin coating, a silver coating tablet, it will cause acidity. Vishes in the cavity definitely will have a very good impact on the spine and spinal issues. So whatever may be the, it may be cervical, it may be lumbar spondylosis or a sciatica or a radiculopathies of cervical or lumbar, we will prescribe an adjuvant drug with other medications. We will prescribe Vishdindagavati as our first drug of choice. It will increase blood circulation in the spine. So once the circulation improves, definitely medicine will work faster. Okay, and it is a Shotahara and Vedana Stapaka also. In that level also it will work. So in that manner, we will use Chitrakadivati as one of our flagship product in case of spinal issues. Okay, any sort of spinal issues, we will use Chitrakadivati, which is the as our one of the prime prescription. Okay, so in that case, if you use excess of Vishdindaka, there is a problem. It may be the acidity, or they may have some severe pain, increase of pain, and some patient will complain about constipation. So all these things we should consider. So this is about only the herbal drugs. Then you think about the mineral drugs also. Well, prescribing Naga, Vanga, so for continuous periods. So lead poison is very common in India because of improper purification and excess use. Improper purification is the first one, and excess of use, second one. So those medicines contains a lead basma. You should be very cautious and we should be very precautious while giving the medicine for longer period. Any Rasaushadis, so better after giving a 30 days or after giving 48 days, better to give some 3 to 5 days of gap. Then you can continue it. So nowhere in our classics they are mentioned Rasaushi should be given to a particular time or particular period. So except Arogya Vardhani. So in Arogya Vardhanivati, Acharya has given the same shloka. Arogya Vardhani should be given for a kushta for a period of 48 days, one mandala kala. How much? One mandala kala. The dose of Arogya Vardhani in kushta, it is for one mandala kala. So how many? 48 days. So more than 48 days, if you prescribe Arogya Vardhani, it's well and good. If kushta will not come down within 48 hours, you can continue. Acharyas are not advised to stop or we can give a break. There is no cautions or precautions given in the shloka. But only one line statement Acharya has given. So how many days Aragvarja should be given? It should be given for 48 days. At least 48 days for the cure of Kushta. So that is the guideline given by an Acharya. So we can take it as a standard guideline for all Rasaushadis. We can give Rasaushadis for 48 days. Then we can give some 3 to 5 days of gap, and then we can continue. So better while prescribing the Rasaushadis, you should take a liver function test at least for 3 months. After 3 months, once you can go with a liver function test. At least once in 3 months. So you have seen many prescriptions and many case histories of rheumatoid arthritis patients. So usually the common drug they will use is methotrexate. So it is an anti-cancerous drug, immunomodulator. So used in case of rheumatoid arthritis, and it is a main hepatotoxic drug. It will damage hepatocytes. So for that reason, that drug should be advised once in a week only, once in 7 days. So still, rheumatologist will advise one liver function test once in 3 months. After review of the liver function test, then only they will prescribe further medications. So these sort of strict rules was made, and there is a strict follow-up was made in allopathy. So like that, we don't have any mandate rules or mandate investigations. So mandate guidelines was not there in our medicines. So once we have want to use these Rasaushadis and Visaushadis, so definitely some impact will be there. If there is a effect, means there must be some side effect. Okay, Newton's third law. Okay, if there is a good effect, definitely there must be a side effect. So that's why in Padartha Vijnana Shloka, Sukha is Sarva Anukula Vedaniyam Sukha. Definitely Vedana will be there. It should be Anukula Vedana. So Acharya may define Sukha in different way, but Acharya has given why the definition Sukha means Sarva Anukula Vedaniyam Sukha. Hita. So even the trekking to the mountain is difficult task. So we need to prepare well, and a lot of tiredness will be there, knee joint pain will be there, but still we will climb the mountain. So after climbing, the scenery and everything will mesmerizing, and we will forget everything. All tiredness will go off. Okay, so that is the effect. Sarva Anukula Vediniyam Sukham. Here also we are getting a lot of benefits with the medicines. That's why we are using it. At the same time, so we should monitor very strictly about the uh, dosage and as well as its side effects in a patient. So we want a quick results, faster results. We must use these medications. So when compared with Rasaushadis and Kast Aushadis, lot of researchers was going on. So in that clinical trials also, the plain herbal medicine and a proper purified Rasaushadi, both they are taken it for a clinical trial in an animal. Okay, so animal study, they will taken with albino rats. So in both the things, so the herbal medicine is more toxic than that of a purified Rasaushadi. Purified, manufactured final product of Rasaushadi is better than that of Swarasa. The trial was done with Brungaraja Swarasa and Sudhishekara Rasa. So why they are taken these two medicines means in Sudhishekara Rasa, Bhavana Dravya is Brungaraja Swarasa. They are taken alone Brungaraja Swarasa and Sudhishekara. They are given a clinical trials. So they are increase the dose of this medicine for 10 times of normal dose. So what the outcome result is, so Brungaraja Swarasa is more toxic than that of Sudhishekara Rasa. So complete finished product is Sudhishekara. Got it? So proper purification, proper manufacturing techniques. So GMP manufacturing techniques, good manufacturing techniques, GMP rules we need to maintain, we need to follow. So then there will be no worry with these side effects. So that's why while prescribing medicines, better to select a good company medicines, good manufacturing company medicines, not a famous company. So we cannot tell all famous company will follow the rules. Because of their work pressure, their demand for the goods, they won't maintain many a times. So that's why, so we can go with some medium level companies, those who follow all the rules, all the manufacturing techniques they have to follow. Okay, whenever you are prescribing a Vishaushadis, you should be very cautious and we should be very strict. In diet rules also, in observing the every condition also. So that's why whenever I will prescribe Vishnu Kavati, I'll advise them to take Guruta much. Okay, Vata Anulomana should be there. So along with that, many a times we will prescribe Eranda Taila. So both are Visha, but Eranda Taila in minimum dose it will act as an Anulomana. Snigdha Anulomana is needed. Okay, so patient will have a Snigdha Anulomana, definitely there will be no issue with the gut. Okay, so that mechanism you should understand, and then you can prescribe the medicines. And one more important thing in any sort of Katishula, Kativedana, Apanavata Vikruti, so the first drug of choice will be Erantathaila. Okay, in Yogaratnakara, Vaishyaratnavali, the standard drug of choice in case of Katishula, Kativedana, you should remember this in your memory for longer period. So wherever you feel like Katishula, Kativedana, so this can be used in case of dysmenorrhea also. So in folklore practice, they will apply some hot coconut oil over the nabi. So during the menstruation to mitigate the pain, dysmenorrhea cases. So one village I have seen, so they will add Irana Taila along with betel leaf, villadele. Villadele jata eat maati, they will put it on the nabi. And they will close it with a betel leaf. So within 2 to 5 minutes, patient will be alright with a severe pain. So this technique they are using for a normal delivery also. So external application, and we will advise Erandathaila internally. Those who are having a severe dysmenorrhea, so before 2 to 3 days of menstrual cycle, we will give you 5 ml of Erandathaila at bedtime, or else you can give 2 capsules of Erandathaila at bedtime. So continuously for 5 to 7 days. There will be no dysmenorrheic pain, there is no menstrual pain, so menstrual cramps, nothing will be happen during the menstrual cycle. So these pains and all because of Apanavata Vikruti. So we have seen many inguinal hernias, fibroids of uterus. So any problem with the garbhashya, problem with the lower part of intestine, so and infertility issues in male infertility. So all these things will connected with apanavata. Okay, so Deepana Pachana and proper Adalomala is the must thing we should follow in case of apanavata Vikriti. Okay, when come to the infertility, when come to the Katishola, when come to the Garbhashaya or Mutrashaya Vikriti, you should think about Erendatail. So one drug. Even in case of renal colic also we advise Erendatail along with Ingu. Fast relief. So one patient called in the midnight, I don't have anything in the home. He's a village guy. So no doctor, no medical shop open in the midnight. It is a severe pain. So what to do with the home remedies? During that time, I have given some TV talks and video classes in TV. So I got call unknown number. So I asked him whether you have a veranda castor oil in the home. So he said yes. So and check Ingu in the kitchen. He said yes. Both Ingu and Erandakala both is available. Take jaggery 1 cup of hot water, 5 ml of Erandakala. So 2 pinches of Ingu and some 5 grams of jaggery. Boil it all together and advise him to take. Within 10 to 15 minutes, patient was all right. 10 to 15 minutes. This effect we won't get by infusing a tramadol injection. It will take some half an hour to 1 hour time. So this medicine will work faster than that of any painkillers, any CNS pain receptor blockers. This is a colicky pain. So after that we have advised him for USG scan. It is a renal calculi. So 5 mm of stone was stuck with the upper pole. It was a renal colic. Okay. So like that, we can manage many things with our simple remedies. But thing is, we must know, we have to experience. These medicines should be advised. That's why the medicine names and medicine will be available in your clinical in your shelf. Then only we can advise or prescribe. It's called as medicine storage or shelving of medicines. It's not a physical shelving; it is a mental shelving. So you have to think. So patient comes with so and so symptoms, whatever the medicines we have, whatever the possible medicines we can prescribe. Okay, so drug shelving must be there before you stepped into the practice. Okay, so we were there with Vishas. We can note down some important agadas and their indication. Okay, Rushabha agada Sarpa Visha. It is not there in the slide. Slide will be shared easily. So whatever not there in the slide, I will going to give you dictation. You can note it down. Rushabhagada Sarpavisha Agradravya. Rushabhagada Sarpavisha Agradravya. Ksharagada Sarva Vishahara. Ksharagada Sarva Vishahara. Gandha Asti Mahagandha Asti. It is there in Charaka Samhita. This reference there in Charaka Samhita. Gandha Asti and Mahagandha Asti. Sarva Vishashabara. If you can prepare this Gandha Asti or Sarva Gandha Asti Agada, so that is your final thing in practice. No need to prescribe any other medications. Only these two medicines are enough. Okay. So just go through the Palashruti of Gandhasti and Mahagandhasti. All indications are there. 90% of the clinical practice will be finished with only these two medicines. Unfortunately, we cannot prepare this. agadas, a lot of because of lack of raw materials and other things. So if you can able to do it, definitely we have a very good results. So try out this preparation of Gandhasti, Magandhasti. So this becomes your lifetime achievement. No need of Nobel Prize and other things. This itself is your lifetime achievement. Okay. So like that, other two medicines are there in Ayurveda. Arka, Kechari Arka. Okay. Kechari Arka means, so after consumption of the particular Arka, so the body will be invisible. Our body, we cannot visible to the normal eyes. Our Kechari Vati is also available in the Shastra. So it's a physics. So after consumption of the particular Arka, our body energy levels will increase like anything, and with energy, our body will be lighter, and we can fly lighter than that of the bird. So we will not visible to the naked eye. So why we can see the objects? Because of reflection. So our rays will go and it will come back. The image will go into form the retina. So that is a normal physics you learned in second PU, how the objects will be visualized in the eyes. If the light will pass through our body means the objects will not be visible. Because of reflection of the light, we can see the objects. The light pass through the particular object means objects will not be visible. After consumption of the Kecharavati or Kechari Arka, the body will allow light to pass out. Lot of energy will be formed. Okay. So these medicines are available in Ayurveda. So we think of preparation. You want a Nobel Prize, you can prepare those medicines and do the clinical trial. Okay. So you do a regular practice and all. So go on research with these medicines, with these products. We have very good result, but we don't know how to use it and how to utilize it in a proper way. Nagadalyadi agada garavisha. Nagadalyadi agada garavisha. Nagadalyadi agada garavisha. Ashtanga agada. Ashtanga agada gonasa sarpavisha. Ashtanga agada gonasa sarpavisha. Tarksha agada. Tarksha agada. Tarksha agada sarvavisha. Tarksha agada sarvavisha. Mahagada, it has a Maha Vega and Maha Prabhava, and it can be used in Sarva Visha. Mahagada can be used in Sarva Visha. Mahagada contains Trivrut, Danti, Yasti, and Aridra. Trivrut, Danti, Yasti, and Aridra. It contains Trivrut, Danti, Yasti, and Aridra. Trivrut, Danti, Yasti, and Aridra. Vamshatvagadi Agada. Vamshatvagadi Agada. Vamshatvagadi Agada. Vamshatvagadi Agada. Luta Visha. Vamshatvagadi Agada. Luta Visha. Kalyanaka Agada. Kalyanaka Gruta, sorry. Kalyanaka Gruta effect will be there in many areas. So there we can use this Vishara properties also there. And as well as Garavisha. Kalyanaka Gruta. And one more property in Kalyanaka Gruta is we can use it as a Pumsavana. We can use it in Pumsavana. Kalyanaka Gruta. Himavanagada. Himavanagada. Mandali Sarpa. And Bilwadi Gulika, Sarva Visha. Bilwadi Gulika, you can use it for Anjana, Pana, Nasya, all those things. Okay. Amruta Agada, Sarpa Visha. Mruta Sanjeevini Agada, Sarva Visha. Mruta Sanjeevini Agada, Sarva Visha. Chandrodaya Gulika, Stavara and Jangamisha, both. Chandrodaya Gulika, Stavara and Jangamisha. Dushi Vishari Agada. Dushi Vishari Agada. Especially indicated in Dushi Visha, especially the Visha is there in Pakvasha. Okay. If the Visha is there in Pakvasha, this is the indication Dushi Vishari Agada. Out of these formulations, we have easily available is Pilvadi Gulika and Dushi Vishari Agada. So Kottakkal from almost all Kerala pharma they are doing these medicines, and as well as Kalanaka Gurda is also available easily in the market. Okay, so always we should targeting easily available drugs in the market. So if you want to prescribe means preparation and other things will take a lot of time and energy, very lethargic work. Okay, so easily available drugs we can uh, purchase and we can consume. It's a easy task. ವಿಷಾಹಾರ ಗಣ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಸುಶ್ರುತದಲ್ಲಿ ಏಲಾದಿ ಗಣ, ವಿಷಾಹಾರ ಗಣ ಸುಶ್ರುತ, ಏಲಾದಿ ಗಣ, ಪಟೋಲಾದಿ ಗಣ, ಅಂಜನಾದಿ ಗಣ, ಲೋದ್ರಾದಿ ಗಣ, ಪಟೋಲಾದಿ, ಅಂಜನಾದಿ, ಲೋದ್ರಾದಿ, ಏಲಾದಿ. So in these ganas, Acharya Sushruta has given Palashruti as Vishaha. Okay. What is the Agra Aushadhi Misha? We can use the first priority for Visha. Agra Aushadhi Misha. Yesterday we discussed Shirisha. Shirisha can be used as an Agra Aushadhi in Visha. So ಅದಕ್ಕೊಂದು ರೌಂಡ್ ಆಫ್ ಮಾಡಿ ಇಟ್ಕೊಳ್ಳಿ ಶಿರೀಷ. ಅಗ್ರ ಔಷಧಿ ಇನ್ ಕೇಸ್ ಆಫ್ ವಿಷ, ಶಿರೀಷ. So ವಿಷಾರ ದ್ರವ್ಯಸ್ ಅಂದ್ರೆ some of the antidotes or drugs. You can call it as Vishahara. Aridra, first one. Aridra. Manjishta. Palindra. Aridra. Manjishta. Palindra. Chandana. Kataka. Kataka, you know, the Nirmali. One more name of Kataka is Nirmali. That is easily you can use in case of water purification. Kataka, Kataka Phala. We are using it as a drug of choice in water purification. Kataka. Shirisha, Shleshmantaka. Manjishta, Manjishta note ಮಾಡ್ಕೊಂಡ್ರ. Okay. Haridra, Manjishta, Palindra, Chandana, Kataka, Shirisha, Shleshmantaka. Vishakanya reference will bear in Sushruta, Ashtangas, in both the chapters. So Sushita Uttara Kalpasthana, first chapter we have a reference of Vishakanya. In Ashtanga Sangraha, Anna Raksha Vijayataya, sixth chapter it may be. There also we have a reference of Vishakanya. Okay. This is about important agadas and important dravyas and their Shodhana procedures. So in the first class we discussed about the syllabus of Agada Tantra. So there I told you in the beginning. So Visha definition, Visha gunas, Visha classification, Stavara Visha, Jangama Visha. And then when come to the Jangama Visha, so there Visha Vega Lakshana, Visha Vega Chikitsa, and Visha Adhishta. These are all the important FAQs. So here we need to memorize a lot of things. So I will just move on fast with these slides. So I will tell you this slide is important means you can make a note of it and you have to memorize. I will share all the slides by today evening. After the class I will share. So I will make a PDF and I will send you in the group. Okay. So those things we have to memorize. So now you no need to make some extra mnemonics and all. So first you can memorize directly and you do some memory tagging. That is important. So mnemonics is a very old technique. Okay. So by remembering something by their first or second letter or by keeping some numbers and other thing. So it's a older thing. Nowadays, the most improvised memory technique is imagine. So you should look with your inner eyes. So what type of sarpa is there? So usually in olden days, lot of poisonous animals will be there. A poisonous snake in India, it is about from 6 feet or 8 feet. In olden days, they are telling it is 15 feet, 20 feet. And even the lutas. So lutas, what we are observing in the home is not a luta actually. Their variety is that poisonous lutas. Just by smelling only a patient will die. So by Divya Sarpa Dushti only patient will die. So these are the things was there in olden days. Now we cannot able to we can able to see those things. So it may be there in thick forest, it may be in Amazon forest. We don't notice all those things. It may be there. Okay, but something our classics was written during 2500 years back. This much of scientific revolution was not there during that period. This much of planets and Mars, everything was not there in during that period. So they're written according to their imagination, according to their experience, according to their lifestyle, according to their food style, according to that season. Okay, so now we are 2500 years advanced from our samhitas. So these things we just keep it in our mind for examination. Don't find it science in it, something. Okay, so just keep it in your mind for the purpose of examination. The thing is, you should imagine and read. Whatever you can read, just imagine and read. So while reading, you should see different objects. For example, you are sitting and reading in a terrace or somewhere else. You just listen some tree over there, and you are reading the things. So when you remember the things, you will remember the tree also. Okay, so you just tagging some bucket, and I'll read some shloka. So whenever you remember the bucket, you will remember the shloka. Whenever you remember the shloka, you will remember the bucket. So this is memory tagging and imagining memory. Okay, so the left brain is imaginary, the right brain is calculation. So you should mix both calculations and imaginations. So for that reason, use both the hands for memory training. So writing and all, you should use right hand for making memory while underlining, making brackets. So darkening the things, you should use left hand. You can train your memory well. So right and left coordination. So try to practice some activities from left hand. So that will stimulate both the brains at a time. So that you won't get tiredness while doing the things. And you use some multicolors while making the notes, while making the reading, revisions, and other things. So colors always looks good, one thing, and memory tagging will also be very good. You can use pencil, you can use green pen, you can use red pen, you can use blue pen. So apart from that, any other colors also you can use. At least some four colors. With pencil, it becomes five. Okay, red, blue, yellow, black. With pencil, at least five colors easily available. You can use it. And while making notes, you just give some space after one page, or if after completion of a page, you just give some space. And if you're writing in a white paper means, you definitely will get some space. Don't make notes very thickly. So while revision also, you will get something in the mind. You can draw a picture, or you can draw a chart, or you can do any drawings over there for remembering in future. Okay, so that thing you can follow. Or if you are following any notes, so you add some pages, white pages in between the notes. Okay, my advice is while making a notes of an each individual subject, so just keep some 20 to 30 pages of white pages, and whatever the material you have from our classes or from other classes, just keep it in the particular file. Agada tantra means you must open one file, that's all. That file contains some 20 to 30 pages of information. So those information you can condense before exam within 1 or 2 pages. Okay, so then the revision becomes very fast. So we can able to condense Charaka Samhita in single page. If you are strong enough to do it, definitely we can do it. So just before the examination, my Charaka Samhita notes is just a one page. I just write a sthana, total number of chapters. So Yoga Raja is setting so Chavanprasha is setting so and so. Just the chapter name and important things to remember. So one name and two lines to remember. What are things to remember? We can make it a notes like that. So whenever you are going to revise, just write something. The writing memory will be 10-folder than that of a reading memory. Okay, that's why we advise to make your own notes, that too by writing. Okay, so writing always gives you a good memory. Okay, stagnant memory will be improved. Okay, Nagada, so we'll continue. So this is the basic thing. So important Agadas, the important Vichadravyas and their purification and important Agadas. So next is Stavara Vishvaya, Stavara Vishvaya, classification, Vishadhisthana. Like that it will goes on. So I will continue faster these areas. And this is the thing what I am going to teach. You may not remember. So in the home you can give a time and make a memory tag. Important points I will highlight. Okay. So in the slide we have Jangama Visha Adhisthana as per Sushruta Adhisthana according to Sushruta Samhita Kalpasthan. So Drushti, by just seeing the eyes, what are the things? Divya Sarpa. So till today the Vasuki Sarpa, so where God Vishnu residing. Okay, it is the Sarpa is Vasuki. So it is a Divya Sarpa. In the classification of Sarpa, we have two types, Divya Sarpa and Bhoma Sarpa. Okay, so these Divya Sarpas having a drushti. By just seeing the Sarpa, patient will get the poison, the person will get the poisoning. So Ananta Shayana, so Sheshanaga, the Vasuki Sarpa, these are all Divya Sarpas. Just go through it, Divya Sarpa concept and all. And just by Nishvasa also, just by taking the breath from Divya Sarpa also, patient will going to die. And most important is usually they will ask in the examination is uh, Rushchika, easily they will give the stinge of Rushchika, the bite of Rushchika. Biting means they will do it stinge, that one. And then Mushika. Okay. So Mushikadu Adhisthana is Visha Adhisthana and Mushika is Shukra. This is very important one. So Mushika Adhisthana is Shukra. Lutudu Lala. These two. Mushika Adhisthana of Visha in Mushika is Shukra. Luta Artava and Lala. Eradu ide. Here the Uchitinga, they are called as a variety of crab. Here also their Vishadhisthana is Shukra. Okay, Uchitinga, Varati, Shatabadi, their Vishadhisthana is Shukra. Okay. So one folklore practice with Uchitinga crabs is they are using these Uchitingas in erectile dysfunction, medicine in erectile dysfunction. So usually one area they are giving this crab along with pan. They will bite the crab over the pan and they will give the that pan to take. So this Uchitinga Shukra will act as a sildenafil citrate. So you know about the common drug Viagra, the common drug used in allopathy in case of erectile dysfunction. So this drug will act as equal to that of sildenafil citrate, Viagra. Okay. So this is one of the folklore practice, but here the Uchitinga also the Adhisthana of Visha is in Shukra. Okay, Sarvada Samanyam Ruddhikaran. Sarvada Samanam Ruddhikaran. Samanya is always going to increase. Shukra Visha will going to increase Shukra. Okay, that is the concept. Sarvada Sarvabhavanam Samanyam Ruddhikaranam. So go through it once. So Visha Vegas is a very common question. So in human, there are 8 Visha Vegas according to Charaka, 7 Vegas according to Sushruta. So 8th Vega is Marana. In Charaka, 8th Visha Vega is Marana. According to Sushruta, it is 7 Vegas in human beings. Sushtutadu different sarpage different ಇದೆ. ಧಾರ್ವಿಕರ ಮಂಡಲಿ ರಾಜಿಮಾನ್ ಮೂರಕ್ಕೂ ಬೇರೆ ಬೇರೆ ಇದೆ. ಸೊ ಓಪನ್ ಮಾಡ್ಕೊಳ್ಳಿ ಇದರಲ್ಲಿ ಸ್ಲೈಡ್ ಗೊತ್ತಾಗುತ್ತೆ. ಸೌಂಡ್ ಮ್ಯೂಟ್ ಮಾಡಿ ಅಷ್ಟೇ. In animals, it is 4 Vishavegas. Within 4 Vishavegas, the animals will go into die. In birds, it is only 3 Vishavegas. In birds, we have only 3 Vishavega. So it's very common question, very frequently asked question part. Okay. Horizontal ಮಾಡ್ಕೊಳ್ಳಿ ಫುಲ್ ಬರುತ್ತೆ. Keep mobile horizontally, we can get a complete image of the slide. So in human beings, Vishavega according to Charaka is 8. According to Sutta, mute ಮಾಡಿ complete. According to Sutta, it is 7. In animals, it is 4. In birds, it is only 3. This is a very commonly asking question in APG. So Vishavegas in human beings and as well as animals. Okay. So symptoms according to Jangama Vishavega. So according to the Dhatu, they are given symptoms according to Charaka, symptoms according to Sushruta in first Vega, second Vega. So here the question will comes like that. So where patient will get a murchana and where patient will get a Rudaya Vedana. Okay. So recent question paper we have a Murcha Jrumba Vepatu is seen in which Vishavega according to Charaka Sangita. It is there in second Vishavega. Okay. So no confusion. Directly they will give according to Charaka Sushruta. Right? Ikka is the symptom in which Vishavega according to Charaka. So sixth Vishavega according to Charaka Samhita. Okay. Vaivaraneta, Parvaveda, Tafa, Praseka will be there in fifth Vishavega according to Sushruta. So just go through the Vishavegas and tag this Vishavega according to Charaka and Sushruta. So on. So like that question will come in examination. Just go through it. Important one. That slide is important. So just note down the slide, Vishavega and their Lakshan. According to Charaka and Sushruta. So then comes Sarpa and Sarpa classification, total number of Sarpas and Sarpa classification. So here, direct question will become in the numbers. So total number of Dharvikara Sarpa, total number of Mandalini Sarpa, total number of Nirvisha Sarpas. So like the total numbers, the first question they may ask with the numbers. Okay. So first classification is Sarpa is Divya Sarpa and Bhoma Sarpa. So according to Sushruta, there are 80 Bhoma Sarpa. Okay. Out of that, 12 Nirvisha and 68 Savisha Sarpas. So total number of Sarpas are 80 in number. 80. 80. Okay. So Dharvikar are 26 varieties. Mandalini are 22 varieties. Rajiman are 10 varieties. Nirvisha 12. Vaikaranja 3. This is according to Sushruta. 80 Sarpas according to Sushruta. Okay. Last question paper ಬಂದಿತ್ತಲ್ಲ question 2017-18 ಅಲ್ಲೂ ಇದೆ total number of Nirvisha Sarpas according to Sushruta. Okay. So this classification is holds good during that period. We have a lot of varieties of Sarpas. Okay. So in India, there are main two varieties of venomous snake. Okay. Out of that, King Cobra is the one. It has a venom. So after biting, so patient may die within 45 minutes if they won't do any treatment and other things. So king cobra is one of the deadly and poisonous snake in India. Okay. ಇದರಲ್ಲಿ ಸಿಕ್ಕಾಪಟ್ಟೆ ಇದಾವೆ ಸುಮಾರು ಸ್ನೇಕ್ಸ್ ಇದೆ ನಿಮ್ಗೆ ವೆರೈಟೀಸ್ ನಿಮ್ಗೆ ಯಾವ್ದಾದ್ರು ಸ್ನೇಕ್ ಮ್ಯೂಸಿಯಂಗೆ ಹೋದ್ರೆ ಇನ್ ಫಾರೆನ್ಸಿಕ್ ಮೆಡಿಸಿನ್ ಆಲ್ಸೋ ಲಾಂಟ್ ಲಾಟ್ ಆಫ್ ವಿಷ ಸರ್ಪಾಸ್ ಸೊ ಡಿಸ್ಕವರಿ ಚಾನಲ್ ನೋಡಿದ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ ನಿಮ್ಗೆ ಹೌ ಮೆನಿ ಸರ್ಪಾಸ್ ಆರ್ ದೇರ್ live surface also they will show. And one snake is there, sea snake. It is also a very poisonous one. Within no time, patient will die. Sea snake. So deep oceans ಅಲ್ಲಿ ಇರುತ್ತೆ ಅದು ಇಲ್ಲೆಲ್ಲ ತುಂಬಾ ಕಡಿಮೆ ಬೀಚಸ್ ಅಲ್ಲೆಲ್ಲ ತುಂಬಾ ಕಡಿಮೆ ಬರೋದು ಸೊ ಅದು ಸಣ್ಣದಾಗಿರುತ್ತೆ ಇಟ್ಸ್ ವೆರಿ ಸ್ಮಾಲ್ ಅಂಡ್ ಲಾಂಗ್ ಓಕೆ ಇವನ್ ನಮ್ಗೆ ಬಾವಿಗಳಲ್ಲೆಲ್ಲ ಇರೋದು ಒಳ್ಳೆ ಪಿಂಗ ಅಂತ ಬರುತ್ತೆ ಇಟ್ಸ್ ನಾನ್ ವಿನಾಮಿನಸ್ nothing will happen with a bite of that one. But this one is a venomous. That was sea snake. These two are deadly snakes in India. So ಅದು cobra and viper ಮತ್ತೆ ಇದು sea snake. ಅತ್ಯೇಕ ಚಿಕಿತ್ಸೆದಲ್ಲಿ ಇಟ್ ಇಸ್ ದೇರ್ ಇನ್ ಅವರ್ ಸಿಲೆಬಸ್ ಕೆಸಿ ಬರುತ್ತೆ ಪಿಜಿನಲ್ ಕೂಡ ಬರುತ್ತೆ ಅತ್ಯೇಕ ಚಿಕಿತ್ಸೆ ಎಮರ್ಜೆನ್ಸಿ ಮೆಡಿಸಿನ್ಸ್ ಎಮರ್ಜೆನ್ಸಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಸೊ ಇನ್ ಮಾಡರ್ನ್ ವಾಟ್ ಎವರ್ ಮೇ ಬಿ ದ ಸ್ನೇಕ್ ಬೈಟ್ ಆಂಟಿ ಸ್ನೇಕ್ ವಿನಮ್ ದೇ ವಿಲ್ ಗಿವ್. Okay, the snake poison smuggling, so it's very common in India. So those will grow snakes, so they will extract snake venom and they will sell it to the companies, medical pharmaceutical companies. From that they will prepare a lot of medicines, protein powders, albumin. Okay, it's a very easy source of albumin, snake venom. In Charakasamhita also, Acharya has given us same thing. I have discussed it, I think, with you. In Udara, at Acharya advised to drink Visha. So this chart is not necessary, but Sometimes if the question comes, you should go with it. So caste-wise classification of the Sarpa. So Brahmana, Kshatriya, Vaishya, and Shudra. At what time the Visha is predominant, at what time they will appear, and what is the dosha predominant. So Brahmana Sarpa, the food for Brahmana Sarpa is only Vayu, and the morning it will appear. It will go walk during the morning. Okay, so it will appears only in the morning, and it will bite from the front. It is three dosha predominant. Just like Kshatriya, it will be active in the midday. Okay, so it will eat mushikas. It will bite from right side. Dosha predominant is Vata. Here them ask the dosha predominance, or else from which direction it will going to bite. So these are the things will be there. For PGD purpose, just go with doshas and all. So that is enough. Purusha, Sri, Napumsaka is one more classification of Sarpa. And some question paper they asked about the characteristics of Napumsaka Sarpa. Just note it down. The characteristics features of Napumsaka Sarpa. And Garbhini Sarpa characteristics also they asked. It's not important. My focus in subject is will more orientation towards clinical practice. These unwanted things, unnecessary things, they will ask you to fail the student. That's all. Okay. So for PGT purpose, it's bitter thing, but still we need to study. Still we need to memorize for our survival. Okay. So in my classes, many a times I will concentrate on clinical aspects. So it will be helpful for our lifetime practice. So these things it will be coming, but you just carry out. There is no clinical importance also. It is there in the syllabus. Okay. So the symptoms of Purusha, Napumsaka, Stri, Garbhini Sarpa, Vaikaranja Sarpa, all these symptoms you should go through in Sushtu Samhita. Sushtuta Kalpasthana you should go through deeply. So very deeply you should go through with Sushtuta Kalpasthana. So Dharvikara Mandala Rajiman, this is a very important Sarpas. Kind of Sushtuta, there are mainly three varieties of Sarpa. Dharvikara, Mandala, and Rajiman. How it will appear? So their habits. So where it will, when it will wake up, when it will go, and which time of a day it has a peak poisoning. So when Dharvikara bites in daytime, it is deadly. Okay, so like that. So when at what time, in which age the poison visha is predominant. All those things you should go through it. And nature of Dharvikara visha, it is Ruksha and Katu. Mandala Visha is Amla and Ushna. So Mandala Visha is predominant with Pitta dosha. Dharvikara is predominant with Vata dosha. Rajiman is predominant with Kapha dosha. So just doshi predominance and the age and which age these sarpas are very dominant with their poison, and which time of the day these sarpas will dominate with their poison conditions. So usually soon after, you know about the snakes, the venomous snakes, they will shed their skin. ಹಾವು ಪೊರೆ ಬಿಡುತ್ತೆ ಅಂತ ಕೇಳಿರ್ತೀರ, and you have seen many a times the skin of the snake. So after shedding, the poison will not be much in the snakes. And in female snakes, during their menstrual cycle, during the menstrual period, it is not high. In breeding time, it is not so high poison. So many criteria will be there in assessing the poison effect. So in olden days, the special physicians were there to note down at what time the snake bite has happened and what type of snake was bitten and which direction it was bitten. And ಗಳಿಗೆ ಅಂತ ಕರಿತೀವಿ ನಾವು ಅದಕ್ಕೆ. ಸೊ ಯಾವ ಗಳಿಗೆಯಲ್ಲಿ snake bite ಆಯ್ತು, based on that they will give you the treatment. Okay, many a times in village side the snake will be killed. immediately after the bite, and they will search and they will kill whatever it may be the snake, and they will take that snake to the Vaidya, and they will identify the type of a snake. Based on that, they will give you the treatment. So this was the practice in olden days. Okay, recently also in paper we have seen. So after the snake bite, again he bite the snake and he kill the snake and bring the snake into the hospital along with it. So it is easy to identify the variety of snake, and it is helpful for treatment. What type of snake bite it has happened. Okay, so this is nowadays. In olden days, this criteria was followed. ಆ ಗಳಿಗೆಯಲ್ಲಿ ಯಾವ celestial appearances ಏನಿರ್ತಿತ್ತು, ಗ್ರಹಗಳು how the grahas are moving, and with him how the grahas are moving, and ಏನೋ ಡೆಡ್ಲಿ ಇತ್ತಂತಂದ್ರೆ he won't succeed, he won't leave. So like that also they will come to the conclusion that we can survive or he will not survive. Many times they will bring the patient at so many times brought dead. So patient was dead before coming to the clinics. At that time, they will think whether we can take out the visha from all over the body, whether we can make a life to him. For that reason only, a lot of agadas were there. And when patient come to the clinic in a particular vega, patient will have an ikka. So then they will imagine the so and so patient will come in so and so vega. So they will start treatment accordingly. Why these vegas and other things will be there? So to identify the stage of the poisoning. These vegas are stages of poisoning. Okay, this is our framework. Modern framework is fixed. Anti-snake venom is fixed. Patient may come early or late, whatever it may be. Anti-snake venom is fixed, and dose they will calculate. How many anti-snake venom we can give based on the bite and bite mass and the type of snake. Here with our frames, we can calculate other things and we can give you the treatment. For that reason, these things are important. You should just go through it. And the reasons for snake bite. Sometimes they will bite because of ahara. They will think so it is a mouse or rabbit or some other things. For that reason, they will bite. And padasparshat. If you disturb the snake, they will bite. Okay. Kruddat, ativishat, papa vruyita. So deva rishi ಏನಾದ್ರು ಶಾಪ ಇತ್ತಂತಂದ್ರು ಕೂಡ they will bite. Okay, so these are all the reasons why the snake bite the human being. So many a times it is accidentally it has happened. So we don't know. Snake is also don't know. Okay, during that time it will bite. So based on the position of the fangs, so how many drop of poison is entered into the body, they will calculate. So if it is a left lower, Ashita, it's called as left lower, only 1 drop poison is entered into the body. So it is left upper, Pita, so 2 drops of poison. Right lower, Dakshina, is Rakta, 3 drops. Right upper, Shava, it is 4 drops. Just go through it. So types of snake bite, it's also just go through it. Sarpita, Rudita, Nirvisha. So last page, last question ಬಂದಿತ್ತು. Types of snake bite according to Vagbata. So it is 5. According to Sushita, it is 4. Tundavata, Valida, Valupta, Namstaka. ಹೇಳಿದ್ನಲ್ವಾ? Namstani Pigita. There are totally 5 bite types. Just go through it and memorize. So like that in Kerala book, Bhavishya Purana, this is the description. So teeth, bite mark and effect. Okay, it is a Karali, Gopada with mark, bite mark and it is only little poisonous. Makari is a bow-like, it can be easily treated. So Kalaratri, so leg of Chakora Paksha, so treated with efforts. So Yamaduti means Shofa and Neela Rakta. So over the bite area, we can find heavy Shota and Neela Rakta. So then it becomes incurable. So every area they have some framework. So when patient come to our clinics also, with our experiences, with our medical utility, with our medical medicine storage, we can give some framework. So if patient comes to so and so stage, we can give it cure. Some diseases we cannot give the cure, so that we can fix the stages. Like that also in Kerala. So in according to this book, they have fixed the stages based on the poison and poison effect. ಸರ್ಪಾಂಗ ಅಭಿಘಾತ ಅಂದ್ರೆ ಏನು ಅಂತ ಒಂದು ಕ್ವಶನ್ ಬಂದಿತ್ತು. ಸೊ ಇನ್ 3 years ಬ್ಯಾಕ್ ಒಂದು ಕ್ವಶನ್ ಬಂದಿತ್ತು. ಸರ್ಪಾಂಗ ಅಭಿಘಾತ ಮೀನ್ಸ್ so just slight touch of a snake. So many times we have a psychological impact on our body. So actually snake was not bite us, but still by seeing it or by just touching it, some chemical reaction will happen in our body, some hormonal reaction will happen in our body. The touch area will be get irritated and there will get some show. It's called sarpanga abhihata, just by touch. And one more technical word, shankavisha. What is shankavisha? So shankavisha means suspect poisoning. Actually poisoning was not happened. Okay, so ಏನಾಗುತ್ತೆ ಅಂತ ಅಂದ್ರೆ brain is a super thing that will induce toxin inside the body without the toxin also. So just imagine in one place we are going for a food, and out of 30 persons those who are taken food, 28 will get poison effect, 2 will not get poison effect. Okay, so these 2 persons definitely they have some immunological reactions in the body, so those things will nullify the poison. And without some areas without the poison effect also, we will imagine something happened by eating the food over there. Okay, it is called as shankavisha. So our girala psychologically they have an impact, and these will give you the so and so symptoms: jwara, chardi, murcha, daha, glani, moha, atisara. So just these are all the things will come because of doubting about the poison. Actually there is no poisoning in the body, but they will develop as symptoms. ಏನು ಆಗಿರಲ್ಲ ಅಲ್ಲಿ, ಯಾರಿಗೋ ಒಬ್ಬರಿಗೆ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಬಂದಿರುತ್ತೆ ಅಲ್ಲಿ ಊಟ ಮಾಡಿ, ಸೊ ನನಗೂ ಬರ್ಬೋದು ಅನ್ಕೊಂಡು ಇವೆಲ್ಲ ಸಿಂಪ್ಟಮ್ಸ್ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಡೌಟ್ ಅಬೌಟ್ ದ, it's called as shankavisha. We should differentiate about sarpanga abhigata and shankavisha. Sarpanga abhigata is not actually the snake bite. So they will imagine just by touching the snake or just by seeing the snake, they will imagine, so I have a snake bite. This symptom will start sarpanga abhigata. Shankavisha, actually there is no poisoning in the body. So psychological impact will bring you the poison symptoms. That is shankavisha. So these are all some of the common treatments for sarpanga abhigata and shankavisha. And first and foremost thing is counseling, and psychological counseling is must. So you should give an assurance to the patients, nothing will happen, you will be all right, there is no snake bite and anything, there is no poisoning in your body. So apart from that, we can give draksha, kshira. So very simple medicine. So for drink madhuka and madhu, and chanting of mantras. Okay. So in all upakramas of Visha upakramadalli, first and foremost thing is mantra. So mantra is so strong. So by chanting a particular mantra, that Visha effect will come down. How it will be? So just by chanting a simple mantra won't give you the effect. So mantra vasha, those who having a control over the mantra, if they chant, then only this Visha will nullify. Okay, so it's called as mantra siddhi. So they will going to do mantra siddhi during eclipse, during full moon day, during half moon day. There is a sampradaya, there is a cult for practicing these mantras, and they have to sit in a open well for mantra siddhi, they have to chant these mantra for minimum 1,000 times, or 10,000, or 20,000, or 1 lakh, or 10 lakh. So many times, if you chant the particular mantra, then they only they will get the siddhi, and during the particular time, eclipse time. ಏನಂತ ಅಂದ್ರೆ ಸೋಲಾರ್ ಎಕ್ಲಿಪ್ಸ್ ಅದು ಲೂನರ್ ಎಕ್ಲಿಪ್ಸ್ ಇದ್ದಾಗ ಓಪನ್ ವೆಲ್ ಅಲ್ಲಿ ಸ್ನಾನ ಮಾಡ್ಕೊಂಡು ಅಲ್ಲೋಗಿ ನಿಂತ್ಕೊಂಡು ಆ ಮಂತ್ರನ ಚಾಂಟ್ ಮಾಡ್ತಾ ಇರ್ಬೇಕು. ಅದಕ್ಕೆಲ್ಲ ಗೈಡ್ ಇರ್ತಾರೆ, ಗುರುಗಳು ಇರ್ತಾರೆ. ಸುಮ್ನೆ ಏನೋ ಮಾಡ್ತೀವಿ ಅಂತ ಅಂದ್ರೆ ಮಂತ್ರ ಸಿದ್ಧಿ ಬರಲ್ಲ. ಅಷ್ಟೆಲ್ಲ ಮಂತ್ರ ಸಿದ್ಧಿ ಆದ್ಮೇಲೆನೆ ಇಫ್ ಯು ಜಸ್ಟ್ ಚಾಂಟ್ ದ ಮಂತ್ರ, ಸೊ ದೇ ವಿಲ್ ಗೆಟ್ ದ ರಿಲೀಸ್. After that also, once they get a mantra siddhi again and again, so they should chant and they should improvise, and during full moon and half moon, ಅವಾಗ again ಕಮ್ಮಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. If they follow some unethical things, unritual things, again the mantra siddhi will goes on decrease. During that time, again and again, they have to ಅದಕ್ಕೆ ಟಾಪ್ ಅಪ್ ಮಾಡ್ಕೊತಾ ಇರ್ಬೇಕು. You can call it as a top up. So it's type of black magician. So they are all doing these things. So it's some cult, they are practitioners, they are doing it. Still it is going on. I have seen in one place in folklore practice. So simply they will apply some lepa and they will chant some mantra. Even for scorpion bite, even for snake bite, immediately patient will get all right. So in the stages also patient will get all right. And one Ayurveda Vaidya I have seen in Mysore. So for Vamana, he will chant Vamana Shloka. So he has Vamana Shloka Siddhi. He told if I give any medication also, patient will get vomiting after chanting this mantra. So it's possible. There is a lot of energy with the mantras is there. So mantra is nothing but an energy source. So just by chanting Om, you will develop an ultrasonic waves in our body. So like that particular mantra having some particular wavelength. So that energy will going to impart in the body. Okay, so that energy will improve the body immunity and immunological response, and it will nullify the poison in the body. If you convert that mantras into science, this may be the effect in the body. Okay, and finally Santvana Arshana, the final treatment will be this one. In case of Sarpanga Abhihatahar Shanka Visha. Asadhya Lakshanas of Sarpa, just go through it. ಸೊ ನಮ್ಗೆ ಕಾಮನ್ ಆಗಿ ನಿಮ್ಗೆ ಯಾವುದೇ ಡಿಸೀಸ್ ಅಲ್ಲಿ ಇನ್ಕ್ಯೂರಬಲ್ ಇತ್ತಂದ್ರೆ ಸೊ ಬಾಲ, ವೃದ್ಧ, ಗರ್ಭಿಣಿ. ಸೊ 3 ಥಿಂಗ್ಸ್ ಎಕ್ಸೆಪ್ಷನ್ಸ್ ಬಂದೇ ಬರುತ್ತೆ. ಸೊ ಇಫ್ ಇಟ್ ಇಸ್ ಅ ಬಾಲ, ಇಫ್ ಇಟ್ ಇಸ್ ಅ ವೃದ್ಧ, ಇಫ್ ಇಟ್ ಇಸ್ ಅ ಗರ್ಭಿಣಿ, ಡೆಫಿನೆಟ್ಲಿ ದ ಥಿಂಗ್ಸ್ ವಿಲ್ ಬಿ ಗೋಯಿಂಗ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್. And those who are treating with Sukumaras, those who are treating with only Mrudu Dravyas, ಆ ಪೇಷಂಟ್ಸ್ ಅಲ್ಲಿ ಕೂಡ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಿಕಮ್ಸ್ ಡಿಫಿಕಲ್ಟ್. ಸೊ ಅದಕ್ಕೆ ನಾನು ಅವಾಗಲೇ ಹೇಳಿದ್ನಲ್ಲ, ಗಳಿಗೆ, ಮುಹೂರ್ತ ಅಂಡ್ ಅದರ್ ಥಿಂಗ್ಸ್. ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಟೈಮ್ ಪಂಚಮಿ, ಅಷ್ಟಮಿ, ನವಮಿ, ಆಶ್ಲೇಷ, ವಿಶಾಖ, ಡ್ಯೂರಿಂಗ್ ದಟ್ ಟೈಮ್ಸ್ if the snake bite happens, so these things will be very difficult. Next comes Sarpa Visha Vega. So Sushrita and Vagbata describes 7 Visha Vega in Alambayana. So Rakta Mamsa Rasa Snayu Asti Majja and Shukra, like that Dhatugata Visha Vega is explained in Alambayana. I had given you which is Alambayana, one of the ancient toxicological book. So in Charaka Samhita is written by Atreya Purarvasu, Agnivesha Kritaya Tantra, Charaka Pratisam. Agnivesha, how Agnivesha written the Charaka Samhita from the Atreya Ovach, Bhagwan Atreya. So in every shloka of Charaka Samhita, he dedicated his writings towards the Atreya. Whatever Atreya told, he only documented it. Okay, so here in Charaka Samhita we have 8 Vegas, starting with Rasadi Dhatus ending in Marada. So these Visha Vegas are very important charts. So you need to memorize Visha Vega and as well as Visha Vega Chikits. So here is a chart of Dhatugata Visha Vega, Sushruta Kalpasthana. ಈ ಸುಷ್ಟದಲ್ಲಿ ಏನಂತ ಅಂದ್ರೆ 3 ಸರ್ಪದ್ದು ಸಪರೇಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಸೊ ಧಾರ್ವಿಕರ, ಮಂಡಲಿ, ರಾಜಿಮಾನ್ 3 ಸರ್ಪದ್ದು ಸಪರೇಟ್ ಧಾರ್ವಿಕರ ಒಂದು ಮಿಸ್ ಆಗಿದೆ ಅಲ್ಲಿ, ಆಡ್ ಧಾರ್ವಿಕರ. ಸೊ ಜಸ್ಟ್ ಗೋ ಥ್ರೂ ಇಟ್. ಸೊ ವೆನ್ ವಿಲ್ ಗೆಟ್ ಇದು ಸಿಕ್ಕಾಪಟ್ಟೆ ಕನ್ಫ್ಯೂಷನ್ ಚಾರ್ಟ್. ಸುಮ್ಮನೆ ಓದಿ, ಇಫ್ ಪಾಸಿಬಲ್ ಮೇಕ್ ಎ ಮೆಮೊರಿ ಟ್ಯಾಗಿ. ಓಕೆ, while reading it you should remember the dosha predominance. So ರಾಜಿಮನ್ಯ ಯಾವ ದೋಷ, ಮಂಡಲ ಯಾವ ದೋಷ, ಧಾರ್ವಿಕರ ಯಾವ ದೋಷ. So vata pitta kapha you should remember in the mind, and then you should read. Okay, then the symptom becomes easier. Okay, from rasa mamsa meda kosta asti majjad shukra. And then vegas in animals. This is very important, so easily you can remember. Important is in Aja and Ashvi, the year the Vishavega is similar to that of man. Go and Ashwa, it becomes twice than that of man. Mahisha 3 times. Ustra and elephant. So Ustra is also 3 times. Elephant is 4 times. Just go through it. The questions will come like that. Brahma will appear in which Vega of animals? In animal poisoning. First Vega according to Charaka. Lalasrava Rutpida will be there in which Vishavega in the animals according to Acharya Sushtata. Second Vishavega. So Atharane about the question, so they will take Vishavega and they will ask about in which Vishavega, or else in which second Vishavega, what are the symptoms? Like that. Vice versa question they may ask. Just go through the chart. This is the Vegas in the bird. There are only 3 Vegas. Just go through it. Vishavega and as well as Chikitsa here. Kind of Sushruta Kalpasthana. Shodita Harana is the first thing given in Sushruta, same as in Dharvikara. Here in Rajimanta Sarpavisha, Acharya told Shonita Harana with Alabu and Agada and Madhusarpi. So always previous stages, first and second stages, we can treat it well and faster. Okay, so compared to the stage or 4 stage, first and second stage, we can do faster treatments. Got it? So here Acharya has given Shonita Harana, Rakta Moksha. So in first aid treatment, wherever you can see the first aid treatment for snake bite, whatever may be the snake, first and foremost thing is make a bleed over the area. If you are in a forest, you don't get anything, means take any sharp objects. It may be a stone also. Make a huge wound, make the blood should come out during that area. If bleeding will happen, definitely 50 to 70% of blood will bleed out. So then easily the poison will come out from the body. Okay, if you have a blade, sharp blade, if patient is in a clinic, or then we can also do this. In first Vega, within 10 to 15 minutes, you have to do bleeding. Make a fast bleeding. So like that, you should go through it. Agada, Madhusarpi, Nasya, Nanjana. In 4th Vega, Vamana and Yavagupana. So this question was asked very frequently. Yavagupana is indicated in which Vishavega according to Acharya Sushtita? Yavagupana is in 4th Vishavega. For Dharika Sarpa, Mandali Sharpa, it is in 3rd Vishavega. So in 7th Vishavega, you just notice about it, Tikshna, Avapidana and Anjana. In 7th Vishavega, there is an hallucination, comatose stage, Murcha will be there. And during that period, we need to make the patient to awake. So there is a Tikshna, Avapidana, Nasya, Anjana, Murtni Chikitsa. Murtni Chikitsa and Kakapada Janga Chikitsa. It's an emergency treatment, we can do it. So Kakapada Janga Chikitsa. When you have to open the area here, it's in the Brahmarandra. The skull has to be open and directly we need to put the medicine. So in Sarpavisha is a neurotoxic. So we need to keep brain awake. First thing. Second thing, the medicine should reach brain immediately. Otherwise, patient will die. For that reason, if we give medicine through the oral, so for reaching it will take a lot of time. With the blood also reaching, going to the brain, it will late. Okay. Many a times, immediately medicine won't reach brain because it has to pass so many things. So every medicine, 50% will go to the liver because of circulation. Liver, whatever the chemical, liver will going to nullify it. It may be good, it may be bad, it may be anything. Any chemical, liver will going to kill. Definitely fighting will happen with the liver. Whatever the chemical, if you consume, including medicines. It's called as first pass effect. When the medicine pass through the liver, how much quantity of medicine left after attaining a first pass effect? So that is the dose. Dose fixation is like that only. That difference you will notice when you are giving a paracetamol IV and paracetamol orally. So those who are working in hospitals, you may noticed IV paracetamol is 100 mg, oral paracetamol dose is 500 to 650 mg. Why oral? IV is 100, why oral is 500 to 600? Why can't 100 mg of paracetamol through orally won't work? Okay. So whatever the observed medicine, it will go to liver. Liver will kill the medicine. So then some amount of medicine will escape from the liver metabolism. It will enter into the circulation. It will reach a particular area and that will going to work. So that's why IV and oral, there is a lot of difference. Okay, because of first pass effect. So here Kakapada Janga Chikitsa is an ultimate and last treatment of choice. Here Acharya told to open a Brahmarandra and put the medicine directly into the brain. ಏನಂದ್ರೆ ಸಾಯ್ತಾನೆ ಪೇಷಂಟ್ ಡೆಫಿನೆಟ್ ಬದುಕ್ಸಕ್ಕಾದ್ರೆ ಟ್ರೈ ಮಾಡಿ ಲಾಸ್ಟ್ ಟ್ರೈ ಏನಂದ್ರೆ ಕಾಕಪಾದಜಂಗ ಚಿಕಿತ್ಸೆ ಅಂಡ್ ತೀಕ್ಷ್ಣ ನಸ್ಯ ಶುಡ್ ಬಿ ಅಡ್ವೈಸ್ಡ್. ತೀಕ್ಷ್ಣ ಅಂಜನ, ತೀಕ್ಷ್ಣ ನಸ್ಯ ಅವಾಗ ಏನಿಲ್ಲ. ಸೊ ನಾವು ಮಾಡೋದ್ರಿಂದ ಸಾಯ್ತಾನೆ ಅಂತ ಆಲ್ರೆಡಿ ಸಾಯ್ತಾ ಇದ್ದಾನೆ, ಇನ್ನೇನು ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಇದ್ದಾನೆ, ದೆನ್ ಯು ಕ್ಯಾನ್ ಡು ಕಾಕಪಾದಜಂಗ ಚಿಕಿತ್ಸೆ. ಓಪನ್ ಮಾಡಿ ಕಾಗೆ ಕಾಲ್ ತರ ಯು ನೀಡ್ ಟು ಓಪನ್ ಬ್ರಹ್ಮರಂಧ್ರ ಓವರ್ ದೇರ್. ಯು ಕ್ಯಾನ್ ಪುಟ್ ಮೆಡಿಸಿನ್ ಡೈರೆಕ್ಟ್ಲಿ ಟು ದ ಬ್ರೈನ್. That is Kakapadajanga Chikitsa. Just go through it. Darvikara Mandali Rajiman. So here the treatment protocol made by Acharyas depends on the severity and seriousness of the poison. So first the poison will enter into the Rasa, Rakta, Mamsa, Meda. It will go on like that. So the sequence also you should notice in the previous slides. Here Rasa, Rakta, Mamsa, Meda, Kosta, Asti, Majja, Shukra. It is not just like Rasa, Rakta, Mamsa, Meda. The sequence is bit different according to our Acharya in the Vegas and as well as sequence. Meda admale Kosta, then Asti. Amal Majja and then Shukra. Okay. You just practice this slide, the treatment protocol in particular Vega. Binna Visha anta one condition ide, it is mentioned in Kerala Chikitsa text. Here Visha occupies various sandhis of the body. It will lead to Kampa, Sada, Daha and Moha. Okay, Kampa, Sada, Daha and Moha. So here treatment is Kashaya, Lepana, Tailadara, etc. So yesterday I got one case, they're having very severe ankle joint pain with swelling. Both ankle joint, severe pain and swelling. They had been to allopathy clinics since last 3 months. All reports are said to be normal. And Montex test, they got positive. Montex test is a test done to detect TB. They will give an injection over the hand. Okay, subcutaneous tuberculin antibody they will inject. So if there is a reaction over there, then they will take it as positive. They consider it as a TB arthritis, and they started the anti-tubercular drugs, ATT drugs. From last 15 days, there is no improvement with ATT drugs with painkillers. She is suffering like anything. There is severe pain and swelling. And they have done only this one. They didn't go with any TB confirmatory test. TB Gold is one of the confirmatory test. And rheumatoid arthritis, anti-CCP is the confirmatory test. They done only RA positive or negative. Quantitative won't work. We need to go for a confirmatory test. So TB confirmatory, if it is a chest TB or a lungs TB, it's acid fast basically 3 samples. We need to take sample from the night sample, early morning sample, and the sample should be collected at the time of visit to the laboratory. These are 3 samples. Out of 3 samples, at least 2 samples will have TB bacteria. Then only we can make a diagnosis of lungs TB. In other parts of the body, if they want to confirm the diagnosis, the ultimate diagnosis will be TB silver or TB gold or TB platinum. It's a PCR test, polymerase chain reaction test. It's one of the confirmatory tests in HIV, hepatitis B, in this one also. Same thing was done in reverse PCR test in COVID also, or COVID-19 disease. So such a test we need to conduct in case of TB. So advise them going for TB and CCP, anti-CCP for confirmation. If she has TB, she has to continue. Otherwise, we can look into some other diagnosis. Unfortunately, uric acid is normal, thyroid is normal, ASLO is normal, CRP is normal, ESR is normal. You don't know. So it's under evaluation. We'll inform you after TB Gold and anti-CCP test. So the Visha will stays in the joint. It's called as Binna Visha. What is Binna Visha? The terminology they use for Binna Visha means the poison will be stagnant in joints. Visha Upakrama. So here you can see there are 25 Visha Upakrama kind of Charaka. Chaturvimshati Upakrama of Charaka. So in the first and foremost thing you can see is mantra. Okay, already we discussed the importance of mantra and mantra siddhi. So second one is Arishtabandhana, Utkartana, Nispedana, Chushana, Dahana, Parikshana, Avagahana. So the list will goes on. So just go through it, the list of Charaka Samhita and list of Susha Samhita. If they ask the question is, so they will ask about which is the first one, which is the second one. Okay, first one is mantra, second one is Arishta Bandhan. Utkartana Nispedana. Third, fourth, fifth, at least first 5 you should remember. Question may come like which among the following is not a Visha Upakrama? You will confusion about Visha Upakrama and Shadvidopakrama of Rana. In Shadvidopakrama of Rana, everything is there. Whatever the possible treatments in Ayurveda, everything will be there in Rana Upakrama, including Panchakarma. Okay. So in Visha Upakrama, there are only 24 these things that are advised. You should remember at least these 24 Upakramas exclusively used in case of Visha. Okay. Anjana Nasya Duma Avaleha ಇದೆಲ್ಲ ಗೊತ್ತಾಗ್ಬಿಡುತ್ತೆ easily. So, but you should remember Lepa. Finally, they are advised Mruta Sanjeevani agada. Okay. Just evaluate once all those things. So, nodi idರಲ್ಲಿ difference of opinion. So, in Visha Upakrama, all Shodhanas are advised except Basti. Okay. So, the role of Vata in Visha is very less. Why our Acharya has not advised Basti? So, it is very fast. Shodhana have to be done. So, Brahmana ಮಾಡಂಗಿಲ್ಲ ಇಲ್ಲಿ ವಿಶ್ವೋಪಕ್ರಮದಲ್ಲಿ. So, detoxification is better. We should not do Rasayana so faster because it's an emergency. Okay. So Nasya ide, Omana ide, Ella ide, Rakta Mokshana ide. So Basti was not advised. Omana Virechana Nasya Rakta Mokshana is there. Basti is not. The treatment modality or Panchakarma cannot be done during Visha. In Visha Prasha. Okay. Patya, we can note it down. Saindava, some important cereals and pulses, Shali, Shastika, Kodrama, vegetables like Jivanti. Jivanti is Shaka Shrestha, should remember, which is called as Shaka Shrestha. Shaka means vegetables, and we have the green leafies and these vegetables. Shaka Shrestha is Jivanti. Note it down. It's such a wonderful drug, Jivanti. Vartaka, they are advised. Vartaka is brinjal. So, brinjal contains a lot of histamines. Okay. So, we will contraindicate brinjal in case of allergy, rhinitis, and bronchitis. So, actually, it is needed to nullify the visha inside the body. That's why Acharya has given Vartaka as a nota. But it contains a lot of histamines. It will stimulate a lot of histamines after consumption of brinjal. And even Varanadi Gana Kashaya, where is Kulatta is advised, Madhya is advised, Amla Dravyas are advised. Okay. So, to nullify visha. So, prognosis according to the location. If visha is there in the Kafashaya, it is Sadhya. Pittashaya, Kuchra Sadhya, Vatashaya, Asadhya. So here Vata Ashaya means including the brain. Okay. So neural, if it is already reached the nerves means it is a bit difficult to add that. Otherwise we can add. Vishopadrava, so 16 in number. Vagbhatat Prakara Vishachikitsa is there. The classification according to Vagbhata and Sushruta, Charaka. Vishachikitsa according to Vega here, according to Charaka and according to Sushruta. You don't go through it. Already we explained yesterday. So what's the nama, toxic effect, purification, and antidote. Okay. Jayapala, Datura, Gunja, all other things you should go through it. Vishamushti, Bang, Arkakshira, Nuikshira, Karavira, Langali, Balataka, all these. So I already given the list of agadas. So these are all the agadas used in case of Sarpavisha. Sanjeevanivati. Sanjeevanivati dose in Sarpavisha. You should note down the dose of Sanjeevanivati in Sarpavisha. Tell me tomorrow. Sanjeevanivati is such a drug, it can be used in case of Sarpavisha also. The dose of Sanjeevanivati in Sarpavisha, Sanjeevanivati in Garavisha. You should tell the dose of Sanjeevanivati. Visha Vajra Patra Rasa, Pulankadi Vati, Veera Rudra Rasa, Garudanjana, Mrityupasha Chedi Rasa. I have not heard about all those things, but documented in the classics. Just go through it. Apatya during Sarpavisha should not advise Taila, Kulata, Madhya, and Raj. Next, we'll continue with Kitavisha. So, just take a break for half an hour. Now it is 1:45. We'll resume class at 2:50 or 2:30. It will take another one and a half hour. So we'll finish.